Acoustic reflex threshold testing is a loud stimulation causing a contraction of the stapedius muscle, and it is used to find the site of lesion, but should also be used in comparison with other tests. It also shows what type of hearing loss, so it can show if it's conductive sensory neural or retrocochlear, and it also gives a gross estimation of hearing level. Acoustic reflex threshold testing is measured at 5,000, 1,000, 2,000, and 4,000 hertz. You give the patient instructions saying, please sit still for the testing. You'll hear a series of loud beeps. And then you check the probe fit, make sure everything is fitting correctly. And then you start at an intensity level about 70 decibels and do not go above 105 decibels. You measure the right IPSI, which is presentation and measuring to the right. Left IPSI, which is presentation and measuring to the left, right contra, which is presentation to the right, measuring in the left, and left contra, which is presentation to the left, measuring in the right. And if you get odd results, go ahead and try again. Acoustic reflex threshold testing is measured as present and normal, present and elevated, or absent. 70 to 85 dB is considered normal, 90 to 105 is considered elevated. There should be a change of 0.02 milliliters at least to count it as a reflex, and it should be repeatable or it should grow at a higher intensity. All right, to turn this machine on, you would turn the switch over here to turn it on. To make sure it's working, I would run a test on myself to make sure everything is working all right, or I could plug it in here to make sure everything is working. For the setup that I am in right now, I'd be measuring right IPSI or left contra because the stimulus here is going in on the right and measured in the right, and then the stimulus would be going in the left and measured in the right. In order to set up the reflex test, I would go to Reflex, and then I'm going to choose my right or left. So if I'm doing IPSI, which I am here, I will be choosing the right, and then as you see, it is set up for 500, 1, 2, and 4, starting at 80 or 75 respectively. So I will start off by running an IPSI test on myself. All right, now moving on to left contra. And if I were to switch the sides, it would look like this. This would be the left IPSI presenting and measuring on this side, and right contra presenting on this side, measuring on the left. Acoustic reflex decay measures whether an acoustic reflex can maintain its contraction for about 10 seconds, and it's used to find retrocochlear disorders when it is suspected due to case history, audiologic findings, or abnormal acoustic reflexes. Acoustic reflex decay is measured at 500 and 1,000 hertz. It's presented at 10 dB above the acoustic threshold for the given frequency. You give the patient instructions such as, please sit still for the testing. It'll last about 10 seconds. During the test, you'll hear a loud beep. And then you select the frequency, the intensity, make sure the probe tip fits, and run the test for 10 seconds. If during those 10 seconds it decays by 50%, then it is positive for reflex decay and consistent with a retrocochlear lesion. All right, to turn this machine on, you would turn the switch over here to turn it on. To make sure it's working, I would run a test on myself to make sure everything is working all right, or I could plug it in here to make sure everything is working. In order to get to reflex decay test, I'm going to press this, and then I'm going to go up here and press decay. And then it's set for 1000. We can test at 500 and 1000. So if we test for 1000, my reflex was at 80. So I want to set it 10 dB above at 90. And then I will start. So for this, there was not a 50% decay. This is not positive. There is no retrocochlear lesion for the right IPSI. And then if I wanted to do it for the contra, for what is set up as, I could do left contra and then play it again and then switch the sides to test. And if I were to switch the sides, it would look like this. This would be the left IPSI presenting and measuring on this side, and right contra presenting on this side, measuring on the left. CPT codes are 92550, which is tympanometry and reflexes, 92568, which is acoustic reflex thresholds, IPSI and contra for at least 2 frequencies, and 92570, which is acoustic emittance testing for tympanometry, acoustic reflex thresholds, and acoustic reflex decay.